Okay, hello everyone. My name's Nick Lyons. I'm a veterinary epidemiologist working at the Purbright Institute and also for EUFMD. And one of the things that I do research on while at the Purbright Institute is for vaccine evaluation in the field, mainly for FMD vaccines, but also some other vaccines. And at EUFMD, I'm often involved in doing advisory work on the PCP and post-vaccination monitoring. So today I'm going to talk to you about how the post-vaccination monitoring is intertwined with the progressive control pathway. So let's begin. So first of all, for those that don't know what the progressive control pathway is, it's a stepwise process for FMD control in endemic settings. And the focus of this PCP is on identifying and addressing risks to progressively reduce the disease impact and viral circulation. So the focus here is on foot and mouth disease, but actually there are other sort of progressive control pathways for other diseases as well. But today we're just looking at FMD. So within each of these different stages, there will be indicators and targets, and the whole process is linked into the OIE state official status at the upper end. And this process can apply to a zone within a country or to the entire country. So a key principle of the progressive control pathway is that it's risk-based and it's not prescriptive. So what might work in one country will not necessarily be appropriate for another country. And that's one of the strengths, the flexibility in the system. It's very much focused on what the outcomes are and whether they're being met rather than how you get there. So within the progressive control pathway, there are 4 stages before going into the official OIE status. So stage 0, I guess this is kind of one of the stages, so it's kind of 5, but there's really 4 main stages, because in stage 0, there's no risk-based control and no reliable information. So nothing's really happening in stage 0 usually. In stage 1, during that stage, the processes of identifying the risks is happening with a view to actually developing a control strategy that addresses those risks. And this control strategy aims to reduce the impact of the disease. And when you finalize that plan and you put that plan together, then you go into stage 2 and you're implementing it in stage 2. To get from stage 2 to stage 3, you have to come up with an official control plan to reduce viral circulation. And obviously that's different to reducing disease impact and often involves a lot more intensive control measures to get to stage 3. And then when you're in stage 3 and you have your official control program, once that's endorsed by the OIE, you enter to stage 4. And then from stage 4, you can apply and to go to the official status of FMD-free with vaccination. So during stage 4, you're trying to achieve that status, and then once you've achieved it, then you're in the official status. So that's kind of what the pathway is. So as I'm sure all of you know, vaccination really is a key part of FMD control and is therefore a key part of the progressive control pathway. And so when we look at the different stages, usually different things are happening with vaccines. So in stage 0, you will typically nothing is really happening. There might be some vaccine being used, but it's certainly not risk-based. You might get maybe some big farms in a country that as a country is not doing anything, but some individual farms maybe are getting hold of some vaccines. So it's used a little bit like that. In stage 1, when a country is trying to identify the risks, vaccines are more frequently being used, but again, it's often not risk-based. It's a bit haphazard and is often just used by individual farms, or it might be used in some ring vaccination perhaps, but it's often not really risk-based vaccination. However, in stage 2, when you're trying to reduce the impact of FMD, vaccines are then, always really are being used according to risk. So you're targeting vaccines in risk hotspots to try and reduce disease impact. And this is very efficient way of using vaccines, because usually resources are not unlimited. So you have to use the limited resource, which is your vaccine, in a strategic, targeted way. In stage 3, when you're trying to reduce the circulation of the virus, vaccines, again, are often used to reduce virus circulation, but you often have to use them in a much higher coverage because you're trying to reduce circulation of virus. So you need to be more intensive. And then in stage 4, of course, when you're trying to get freedom of FMD, to get freedom of FMD with vaccination, you need to continue using the vaccines, often with a high coverage, to maintain FMD freedom. So when you think about post-vaccination monitoring, or PVM, the requirements of PVM will vary depending on the PCP stage you're in. So you have to consider, well, what are the outcomes you're trying to achieve in each stage of PCP, and what are the objectives of your control strategy? And then from there, you can define, well, what indicators are being used. So what are the things you need to measure to tell you if the vaccines are working, and what are the targets for those? And again, those indicators, the thing you're actually measuring and the target for that indicator, will also vary on the PCP stage. So when we're thinking about post-vaccination monitoring for FMD, and indeed other diseases as well, for me, these are the 5 major components that we're thinking about. We're thinking about immunogenicity, we're thinking vaccine effectiveness, we're thinking vaccine coverage, population level immunity, and impact assessment. And again, these things will have perhaps different indicators in different stages and different targets in different stages, but bearing in mind what are the outcomes and what are the objectives of the strategy in the different stages, because they can vary in different countries. So this is just a small schematic to kind of show which of these studies are appropriate for the different stages. So in stage 1, 2, 3, and 4, immunogenicity studies are very relevant. You always want to make sure you're getting hold of quality vaccines. Maybe in the higher stages, you want a higher quality vaccine, so you might have different cutoffs or different targets. But really, even a country that's in stage 1 of the PCP, they should be doing immunogenicity studies if they're using vaccines, but also to help prepare them for stage 2. So you need to know if the vaccine is appropriate and if it's of sufficient quality. But really, ideally, you want to know that before you start using it in risk-based control. So it's an appropriate measure to use in stage 1. But these other sorts of studies, the vaccine effectiveness, coverage, population level immunity, and the impact assessments, you're not really doing that so much in stage 1. In stage 1, though, as you develop your risk-based control plan, you're thinking about how you will do these studies. So there's planning involved. But then you actually execute them in stages 2, 3, and 4. And this just shows kind of how the targets can vary, and even the indicators can vary in the different stages. So this is just an example. This isn't like I say, the PCP is not prescriptive. So this is just some numbers I just kind of made up for the purposes of this video. So in stage 1, you might, one of your indicators might be for the immunogenicity study might be certain mean titer for the vaccines you're using. And as you can see, as you go through the different stages, that might increase, because with higher quality vaccines, you might get the immunogenicity is often higher, so you might have a higher measure. So I've just said here over 2.5 for stage 3 and 4, but over 2 for stage 1 and 2. So that's kind of just an example of how the targets might vary. But when you look at vaccine effectiveness, what I've done here is so you only start measuring this in stage 2, and I've said you can see it's like over 70% and over 80% as maybe you want a more effective program when you are going up through the stages. But actually, the indicator can change. So what I've but here in brackets, you can say it says disease in stage 2. And that's because your focus in stage 2 is the vaccines to reduce the incidence of disease. So your measure of effectiveness might be different there, because in stage 3 and also stage 4, but particularly stage 3, your focus is on reducing virus circulation. So the vaccine needs to work at preventing infection at a high level. So that might be your indicator might change there. And again, vaccine coverage, you can see that it can also change. So in stage 2, you might have a vaccine coverage of over 80%. But how are you defining vaccine coverage there? So here I put, for example, the percentage receiving 2 doses in a year. That's the vaccine coverage. But maybe that's that indicator, 2 doses, the vaccine percentage receiving 2 doses a year, maybe in the higher levels that might change to 3 doses in a year, or maybe 4. Or maybe you might say vaccine coverage is defined by young stock receiving 2 doses of vaccine as a primary course, followed by 6 monthly boosters. So you can change the indicator definition as you go through the stages, as well as changing the targets. So, and I've put some other examples here about how population level immunity might vary. So the percentage of epi units of adequate immunity might increase through the stages, and also the impact assessment. So your target for stage 2 might be less than 5% of epi units having clinical FMD in a year, but in the higher stages, you want less than 5% of epi units to have infection in a year. And of course, in stage 4, your target should be no epi units with infection in a year, because you're trying to achieve FMD freedom with vaccination during stage 4. So I hope that gives you a bit of an idea about how the PVM, the post-vaccination monitoring, really is very much interconnected with the progressive control pathway. Monitoring and evaluation is extremely important in stages 2, 3, and 4, and post-vaccination monitoring is a key part of that. So it's necessary in all active stages of the PCP, but these indicators and targets need to be adjusted depending on what the objectives you're trying to achieve, and that will vary depending on what each country is doing. So I hope that makes sense, and feel free to get in touch with us at EUFMD if you have any questions on this.